Good evening, folks. Welcome to the Microbial Comedy Club, where we take serious pathogens and turn them into a barrel of laughs. Tonight, we're diving into the world of Klebsiella pneumonia, or as I like to call it, Klebsi's sneaky tricks. Let's get ready for some microbe madness. Meet Klebsi, the gram-negative, lactose-loving, nonmotile, aerobic rod-shaped bacterium with a capsule as shiny as my hair gel. Klebsi has three subspecies: pneumonia, ozaenae, and rhinoscleromatis. They're like a microbial boy band with their own unique talents. But let's talk about Klebsi's favorite tricks. First up, the killer capsule. It's like Klebsi's superhero cape, protecting it from our immune system. Then there's the Hypermucoviscosity Phenotype. Try saying that 3 times fast. It's the gooey shield that makes Klebsi even harder to defeat. Next, we've got Lipopolysaccharide, the bad boy molecule that ramps up the virulence. And don't forget the Siderophores, Klebsi's iron-thieving minions. Iron, after all, is Klebsi's favorite snack. But wait, there's more. Klebsi has Pili, little hair-like structures that help it stick to your tissues like an unwanted party guest. These are the 5 most important virulence factors. Let's call them the high fivers. Never forget them. Here's a quick mnemonic: CHIPS, CHIPS, capsule, hypermucoviscosity, iron-thieving Siderophores, Pili, and the structural lipopolysaccharide. And let's not forget the KPF28 fimbria, promoting bowel colonization. It's like Klebsi's way of setting up camp in your gut. Now, where does this tricky bacterium hang out? Mostly in the human mouth and intestine. Yep, Klebsi is a freeloader. In fact, about 5.38% of people carry it in their stool and 1.6% in their nasopharynx. But here's a fun fact. Ambulatory alcoholics have higher nasopharyngeal carriage rates. Klebsi loves a good party. Klebsi's tricks don't stop there. It causes 3 to 8% of all nosocomial infections. That's hospital talk for hospital-acquired. Common infections include urinary tract infections, pneumonia, and bacteremia. If you have diabetes, alcoholism, malignancy, or you're on glucocorticoids, Klebsiella's got its eye on you. Now, let's talk about Klebsiella's sneaky moves. It's an expert at antibiotic resistance. Ever heard of ESBL? Extended spectrum beta-lactamase. It's like Klebsi's invisible shield against beta-lactam antibiotics. Klebsiella pneumonia-producing ESBLs is a real pain in the neck. And don't even get me started on carbapenem resistance. Klebsi can dodge those antibiotics too, thanks to carbapenem hydrolyzing beta-lactamases and loss of outer membrane porins. Talk about slippery. Klebsiella's clinical syndromes are no joke. Pulmonary infections, bacteremia, liver abscesses, urinary tract infections, and soft tissue infections. Klebsiella's got a whole menu of nasty tricks. It's particularly known for causing nosocomial pneumonia in both ventilated and unventilated patients. And if it hits the community, it's severe and often needs hospitalization. Klebsi's like that terrible guest who overstays their welcome. Diagnosing Klebsi is a bit like playing hide and seek. You isolate it from a culture, and on a gram stain, it appears as short, plump, gram-negative bacilli with a clear capsule. Treatment involves antibiotics, but you better believe we need susceptibility testing first. For tissue abscesses, drainage is a must. And for endophthalmitis, intravitreal antibiotics and vitrectomy are in order. And now, my friends, to make sure you remember all of Klebsi's tricks, here's a handy mnemonic. Klebsi eats chips. K. Klebsiella identifies the organism. L. Lactose-fermenting, important metabolic feature. E. Extended spectrum beta-lactamase, ESBL, production. B. Bowel colonization with KPF28 fimbria, promotes adherence. S. Soft tissue infections, various clinical syndromes. I. Impaired host defenses, risk factors, diabetes, alcoholism, etc. C. Capsule, key virulence factor. H. Hypermucoviscosity, Sticky gooey shield. I. Iron-thieving Siderophores. Loves iron. P. Pili. Facilitate adhesion to host tissues. S. Structural Lipopolysaccharide. Key virulence factor. Klebsiella eats chips, encapsulates the key features and virulence factors of Klebsiella pneumonia, making it easier to remember the organism's important characteristics. In conclusion, folks, Klebsiella pneumonia is a major nosocomial pathogen with a bag full of tricks, from virulence factors to antibiotic resistance. It's a nasty bugger, but with proper infection control practices, we can keep it in check. Thanks for tuning into the Microbial Comedy Club. Stay safe, stay clean, and remember, Klebsiella may be tricky, but knowledge is our best defense. Good night, everyone, and don't forget to like and subscribe to the Infection Tube for more hilarious and informative content.